is ABC 15 Daybreak.
Well, we have a health alert for parents this morning at 6:16. Doctors are telling us that kidney stones are affecting more and more of our children. So what can we do to help prevent them? ABC 15's Brian McElhatton is live in Phoenix working to keep your family healthy. Brian, first of all, how common are kidney stones in children?
Well, good morning, Connie. Not as common as they are in older adults. Maybe you've heard your grandfather or an uncle talking about them. But the cases of kidney stones in children has doubled over the past decade. And this is what we're talking about. These are kidney stones that dissolved, they're salts and other minerals that come out of your urine and form in your body. And they cause big problems, lots of pain. They can form solitary or they can form in groups. I want to introduce to you Mark Hong, who deals with these on a daily basis. You're a urologist. And the biggest reason, dehydration. We're simply not drinking enough.
That's right, Brian. We just don't drink enough to be able to prevent these stones from forming, especially here in the desert.
And we've got some examples here. Those 2 bottles of water, this is what children should be drinking, right?
Yeah, I mean, first of all, you know, we all could use more water, but at the end of the day, you know, as a child, you really want to be drinking at least 1 to 2 of these. If you're less than 5 years old, 5 to 10, over 10 years old, drink at least 2 to 4 of these. And of course, as an adolescent, probably want to be drinking about 5 to 8 of these a day.
Yeah, more like that massive bottle of water.
Pretty much, this is what you should be drinking as an adult or an adolescent. Okay. That's right.
And there are some other causes too. I've got a graphic. I've got a whole list of causes of kidney stones for you. It starts with dehydration. We're also talking about diet and obesity and electrolyte imbalance. What do we do about that?
Well, the biggest electrolyte imbalance is really your salt intake. We've got an epidemic of obesity. We've also got an epidemic of salt intake. And the salt is pretty much in everything. Anything in a package, in a box, in a can, has tons of sodium. And sodium definitely helps form kidney stones. So I think it's really important as we watch what we eat and also what our children eat to really think about how much sodium is going in.
Sure. Dr. Mark Hong, thank you so much for letting us know about this. Again, the number of kidney stones going up in children. We're not drinking enough. We're not eating the right things. So if you want more information, you could head over to our website, abc15.com. We're going to put a whole spread there for you so you can know what to do and how to prevent these things, Connie. They can be really, really painful. And the truth is, there's not much you can do about them. You just kind of have to let them pass through you. And that is an awful experience if you know anyone who's ever had one.
Yeah, no kidding. And I love that you put that list together. I look at the electrolytes, and for me as a parent, I think, what is Gatorade and things like that? Are those okay for my kids?
Yeah, well, why don't we ask that real quick? Gatorade, sports drinks instead of water.
So I'm a big fan of just water because it turns out Gatorade has sucrose in it. There are certain compounds that can actually help form stones as well. I don't like sodas because of the same reason. Also, teas have a lot of oxalate, which is a major component of stones. So, you know, water is always the best thing. If you have to have a little bit, maybe some orange juice, some grapefruit juice can help. But to be honest, water is really the best antidote.
Okay, so there you go, Connie. You heard it from the doctor himself. Stick with the water, less sports drinks, fewer sodas, that sort of thing.
All right, great. Thank you so much, Brian. We appreciate it.